Today's topic is spread of tumors. This is a cardinal feature of malignant tumors. There are two types of spread: local invasion or direct spread, metastasis or distant spread. Local invasion. Malignant tumors show invasion, infiltration, and destruction. Tumors invade via route of least resistance, that is, tissue spaces, lymphatics, veins, perineural spaces. Dense collagen, elastic tissue, cartilage are more resistant to invasion. Metastasis. Metastasis is defined as spread of tumor by invasion in such a way that discontinuous secondary tumor masses are formed at the site of lodgement. Routes of metastasis include 1. Lymphatic spread, 2. Hematogenous spread, 3. Spread along body cavities and natural passages. Lymphatic spread. Involvement of lymph nodes by malignant cells occurs by 1. Lymphatic permeation. Lymphatics are readily invaded by cancer cells and may form a continuous growth in lymphatic channels. 2. Lymphatic emboli. Malignant cells may detach to form tumor emboli so as to be carried along to next draining lymph node. Regional nodal metastasis, that is, regional lymph nodes draining the tumor, are invariably involved. Example 1. Carcinoma of breast metastasis to axillary lymph node. 2. Papillary carcinoma thyroid metastasis to cervical lymph node. 2. Hematogenous spread. Metastasis occurs via blood, mainly through veins. Common sites of metastasis: liver, lungs, brain, bones, kidney, and adrenals. Grossly, blood-borne metastases in an organ appear as multiple rounded nodules of varying size scattered throughout the organ. Microscopically, secondary deposits generally reproduce the structure of the primary tumor. For example, carcinoma colon metastasizing to the liver. Follicular carcinoma thyroid metastasizes to the bone. Now, spread along body cavities and natural passages. 1. Transcoelomic spread. Tumor cells invade along serosal lining of coelomic cavity and spread along coelomic fluid to get deposited elsewhere in the body cavity. For example, 1. Carcinoma of the stomach seeding to both ovaries. 2. Carcinoma of bronchus and breast spreading to pleural and peritoneal cavities. 2. spread along epithelium-lined surface. Example, carcinoma of endometrium or ovary to fallopian tube. 3. Spread via cerebrospinal fluid. 4. Implantation. Spread of cancers via implantation by surgeon scalpel, needles, sutures, and direct prolonged contact. Example, carcinoma of upper lip spreading to lower lip by constant contact. Now, mechanism and biology of invasion and metastasis. The process of spread involves passage through barriers before gaining access to the vascular lumen. This includes making the passage by dissolution of extracellular matrix at 3 levels. 1. At the basement membrane of tumor itself. 2. At the level of interstitial connective tissue. 3. Basement membrane of microvasculature. Sequential steps involved in tumor invasion or metastasis. 1. Aggressive clonal proliferation and angiogenesis. A subpopulation of rapidly proliferating monoclonal tumor cells acquire the characteristics to complete the steps involved in development of metastasis. New vessels formed to support the tumor growth are more vulnerable to invasion by cancer cells. 2. Tumor cell loosening. Loosening of cancer cells occurs by inactivation of cell adhesion molecules. Example, E-catherine. 3. Tumor cell ECM interaction. Attachment of cancer cells to extracellular matrix proteins, laminin, and loss of integrins facilitate invasion. 4. Degradation of extracellular matrix. Tumor cells overexpress proteases and metalloproteinases, that is, matrix degrading enzymes. These enzymes dissolve extracellular matrix, then basement membrane of tumor cells, interstitial matrix, and basement membrane of vessels. 5. Entry of tumor cells into capillary lumen. Migration of tumor cells into the vessel lumen is facilitated by 1. Autocrine motility factor. 2. Cleavage products of matrix components. 6. Thrombus formation. Tumor cells protruding into lumen of capillaries get covered by constituents of blood to form thrombus. Thrombus provide nourishment to tumor cells and protect it from immune attack. 7. Extravasation of tumor cells. Tumor cells in circulation may mechanically block the vessel attached to vascular endothelium and then extravasate to extravascular space. 8. Survival and growth of metastatic deposit. Extravasated tumor cells on lodgement in right environment grow further under the influence of growth factors produced by host tissue, tumor cells, and cleavage products of matrix proteins like PDGF, FGF, TGF beta, VEGF. Thank you.